Hi everyone, my name is Kavita. Today we're going to be walking you through a research paper which we reviewed, which essentially uses ensemble-based methods for directly estimating causal effects. And it's also an investigation of how tree-based G computation techniques compare against regression tree-based approaches. So a bit of background about the paper itself. Increasingly, observational studies have been used to study causal treatment effects. However, as all of you already know, observational data has the disadvantage of not having measured outcomes for both treated as well as untreated populations. So essentially, this diagram summarizes the issue with observational studies, which is the assigned treatment group has a response metric, whereas an unassigned treatment group essentially does not have a response metric, and this is considered as missing data. So how do we really know the effect of a treatment when we do not know what the effect of not treating a given patient is? So that's when imputing an outcome becomes very relevant. So this paper discusses the uses of ensemble-based methods to estimate the average treatment effect in observational studies where outcomes are imputed. So the authors use extensive series of Monte Carlo simulations to estimate the bias, variance, and also MSE of treatment effects, estimated using various ensemble methods. And specifically, the ensemble methods that they consider in this research paper are bagged regression, boosted regression, and also the gradient regression techniques. So we will be uh, giving you an overview of all of those techniques and also summarizing the results for you. Again, going back to the key objectives of the study, the first one is to examine the utility of ensemble-based methods for estimating causal treatment effects. And specifically, the focus was on the three techniques that I just told you about, which is boosted regression, random forest, and bagged regression. And the study essentially achieves this objective in two ways. The first one is by using extensive series of Monte Carlo simulations, they compare the relative ability of different methods to determine average treatment effects. They also use Monte Carlo simulations to understand the treatment bias, the variance, and also the mean squared error across different approaches. And lastly, they compare the estimates of the in-hospital smoking cessation counseling on mortality in a sample of patients hospitalized with an acute myocardial infarction. So essentially, the case study of interest is the in-hospital counseling for smoking cessation and what kind of an impact that treatment has on mortality 3 years post-discharge. Before we jump into the analysis, a little bit of review of what regression trees are and how they work. So when it comes to bagging, essentially what the technique uses repeated bootstrapped samples, which are extracted from the source randomly, and a regression tree is grown for each sample. And in this particular paper, there were 100 samples generated by growing trees for each of those 100 samples. And finally, what happens is the final outcome is essentially an average across predictions within each tree. Random forest also works the same way, with the only difference being the number of predictor variables that are used for each of the subsamples that are generated randomly are a subset of the total set of predictor variables. And this subset of predictor variables can be defaulted to the total number by 3, divided by 3, and that's what was used in this study. An overview of boosted regression trees. So as you can see here, it's based on weighted learning. So there's the classifiers work in estimating or classifying what is correct and what was correct, what was misclassified. And every time the classifier does the correct classification, it's weighted heavily compared to the weak classifiers, which are weighted lightly. And ultimately, the summation of all the weak classifiers essentially gives the prediction for the sequence. So the weighted majority vote is used to produce the final outcome. A bit of overview of the data source that was used for the study. So as we briefly touched upon earlier, the specific case study that was used was in hospitals counseling for smoking cessation. and its impact on mortality 3 years from discharge. So essentially, the sample size, the clinical data was obtained by retrospective chart review on a sample of patients discharged alive from 102 Ontario hospitals between April 1st, 1999 and 2001. So it's 2 years worth of data. The total number of subjects were 2,342, out of which 1,588 were treated, 754 were not treated. And through extensive feature identification techniques, the authors narrowed down on 33 baseline covariates, which were of significance, both in the treated as well as the untreated group. And essentially, the outcome of interest that was used within the study was whether the patient survived after 3 years of discharge or did the patient die. So this is the data set that they procured.
Hi everyone, my name is Claire and I'll be taking you through the Monte Carlo simulation method and then the results covered in this paper. So for the Monte Carlo simulations, they had 10 baseline covariates that they considered, 4 of which had normal distribution, 6 Bernoulli distribution. And they threw all of these baseline covariants into these data generation scenarios, 5 of which are mentioned here. So as you can see, they vary in if they're additive or linear or a combination of the two or not at all. And they did that to see how these different estimation methods performed with these data generation scenarios. They also threw in 2 more data generation scenarios, which we'll see in the results here in a second, E2 and G2, just to make things a little bit more interesting. And those are mild and moderate, nonlinear, and non-additive. So a little bit more interesting. So of these data generation scenarios, they then generated all of these data through this Monte Carlo simulation. And they randomly generated 1,000 data sets. And then they imputed outcomes using the 3 methods that we care about and that we're talking about today: boosted regression, bagged regression, and random forests. And then we looked at potential outcomes and biases. So let's look at that. So they did this for continuous outcomes and binary outcomes. They did a lot. They also used regression methods to directly impute the potential outcomes, so that's on the top. And then inverse probability of treatment weighting, which is on the bottom and is going to be referred to as IPTW from here on out. So using the regression methods, we can see that the MBENS method and the G computation, so that's the most kind of the classic methods that we're comparing to, have the least amount of bias for models A through G, but they really don't do well when things get nonlinear and non-additive. That's E2 and G2. So lots of bias here. And then we look at the kind of rest of the methods and we see that boosting at interaction depths 3 and 4 don't do as well as traditional methods, but they tend to do better when things are nonlinear and non-additive. So over here, the biases are a little bit lower when compared to the classic methods. And then when we kind of look at the bottom, IPTW, it doesn't look great. We see a lot of big numbers. So regression methods kind of work better in this case. So for binary outcomes, things get a little bit more confusing. So G computation performs the best in 2 of the 7 scenarios here. They're highlighted in green. But again, when things get nonlinear, non-additive, incorrectly specified with E2 and G2, things start to not do well at all. We see a little bit more consistency with the boosting in interaction depths 3 and 4. But again, it's not great when we get to E2 and G2. But it's better than the MBENS method and the G computation. So no ensemble method has uniformly superior performance. And then we kind of look at down at the bottom here again at the IPTW, and nothing does great. There's a lot of big values down here. So again, using that, maybe not as great as the regression methods. Finally, we can also look at the MSE results, so the mean squared error from the simulations, and basically what we kind of see here is that there's not a ton of consistency, but boosting at interaction depths 3 and 4 results in the smallest MSE out of all of these methods when things are, again, nonlinear, non-additive, E2 and G2. So that appears, again, to also be consistent. So now we're going to look at the case study results. So this is the estimated treatment effect on smoking cessation on 3-year mortality. So as Kavita said, if you were alive or not after 3 years. And here we can see that boosting at interaction depths, again, seems to be pretty consistent relative to one another, and the random forests also do pretty well. So we can see for the average treatment effect here, these values are pretty close. That makes sense because these boosting methods, though they don't have superior performance every time, they tend to have pretty consistent performance as seen in the Monte Carlo simulations.